So I work for a place where I have to get tested for TB every year. And unfortunately, I'm allergic to the TB skin test. So that means a blood draw or the quantiferum gold every year. For almost the last 10 years, I've been doing that. I have had one false positive before now, but late this summer, I got a positive TB gold test and went in, had a chest x-ray that was negative, had a follow-up retest of the TB gold, also positive. And so I met with a specialist and looking like I have latent TB. Apparently it's out in the community. You can just catch it going to the grocery store if you breathe in air that's infected. I'll talk a little bit more about that and what that looks like in the future. But anyways, I went in, was given the different risk breakdown. So the risk factor that I have for it to activate anytime soon would be like 0.04%. And then my lifetime risk of having it activate by the time that I am 80, and by activate I mean turn from latent TB into active TB, that would have been about 4%. So I was given the choice of treating it or not treating it. And if I didn't have bad luck, I wouldn't have any luck. So I decided to go ahead and treat it because with my luck, for sure, it'll turn to active. But as they outlined some of the different process and side effects and experiences of people going through the treatment for TB, it can be extremely miserable with a high dose of antibiotics that you're on. So at my specific provider, that looks like one dose a week for 3 months. So I'm looking at 12 doses, and I'm a full-time student getting my PhD, and I work full-time teaching. And so I really just felt like I didn't know if I could handle the brain fog, the muscle and joint pain, potential paresthesias, which they give you vitamin to counteract that. It can turn your secretions orange, so sweat. My contacts that I wear can be stained orange, just all this stuff that really sounds unpleasant, especially the brain fog and fatigue. With how much I have on my plate, I also have 2 little girls. You know, I'm married, I have a household to run and keep up, and then everything else. I just didn't think I could start it. I also had an injury of my knee, which I'll tell you about in a different video series. But I delayed starting it when I was in physical therapy, finishing up recovery from my knee surgery this fall. And I decided to go ahead and proceed with the treatment this basically winter. So I had to get my blood retested because this medication regimen can be toxic to your liver. And everything came back great. So I was able to go ahead and start the medication. I really hemmed and hawed about when to do it because every other Friday I work a 12-hour shift. So I didn't want to do it Thursday. I didn't really want to take it Friday and ruin my weekend with my kids and my husband. I didn't want to take it at the end of the weekend because then I wouldn't really be able to, study and do great homework and participate in my teaching and grading that I do as a teacher. And so there really just was no good day. And so my family kind of peer pressured me to start it on Friday. So I had my first dose on Friday, and I'll break these into dosing videos. But that's kind of the short story.